Hello and welcome to everybody watching at home or wherever you're watching this from. Today, we've got myself, Ben, and we've got Phil from Tailored Health, and we are with Alex, who is a psychologist, and he runs his own practice, which is Still Point Psychology. Welcome, Alex. Thanks for joining us.
No worries.
Okay, so what's happened is we have put it out to our Tailored Health community to say, what would you be asking a psychologist right now? And to give broader context, we are in Victoria and we might be up to week 5 or 6 of lockdown. I've sort of lost track, but we've got a few questions here and it's just going to be amazing just to get a few insights from Alex and maybe some next steps. So without further ado, I might just start with question 1, Alex, and we'll get stuck into it.
Sure.
So this question came in, it was around how do we maintain hope in the current situation with ongoing and frequent lockdowns with no real defined end sight to these lockdowns. There is a bit more context, which I'll probably just provide so that everyone understands it a bit deeper. When we can't see family, friends, and loved ones who may only live slightly more than over the 5K limit, without much hope, it's difficult to maintain positivity and motivation. To even go for a daily walk, it can be difficult to feel motivated, particularly when you see others not doing the right thing. So I feel like this covers a whole bunch of things. Not wearing masks, not distancing, gathering in groups and things. So that's the context around it.
Yeah, sure. Okay, so I'll sort of jump straight into that. And how do we sort of maintain hope? Now, there's a lot of kind of interesting research happened with returning veterans who were prisoners of war, both from Vietnam and Second World War as well. So you had large numbers of people in a similar situation. So you could look at differences and you could make generalizations based on that data. And so what was noticed was that people who were overly optimistic once they were a prisoner of war thought, we'll be home by Christmas, we'll see our families soon, we're going to win, don't worry, we just got to wait this out. Those people succumb to depression and lethargy and sort of shutdown disorders at a higher rate than the people who said, all right, we don't know how long we're going to be in this. We don't know how bad it's going to be. They might all just shoot us. That might happen. Right? Let's just put it on the table, basically. Those people who addressed the true likelihood of the situation, which is that it was unknown and precarious, and then responded by saying, okay, well, what can I do in this situation? Right, what can I do? Well, I can look after other people around me. All right, I can look after my physical health to a certain extent. I can try and stay mentally stimulated. I can pick goals and try and reach them. So those people were able to manage pretty well. Now, if you recall that film, The Great Escape, have you seen The Great Escape? Seen that film? Or not?
Yes, I have. Yes.
Yeah, and look, in the start of the film, it shows them in a kind of a bird watching class, and you kind of think, well, why are they doing a bird watching class? It's because they realized that they had to set up education and mentally stimulating activities inside that situation, or else people just become shut down and bored. So you have to create, in a sense, new things to fill up the space of what is missing. All right. So it's like staying busy, staying mentally focused. And what that was showing was that we have to put the attention on what we can control to make up for the things that we can't control. And hope can be hopium. It's a short-term palliative, but it's makes you very vulnerable. So we'll be home by Christmas, and then you're not home by Christmas. You're in a world of despair right now because you're mentally kind of, it's October and we're still not going home. It's November, we're still not going home. So you can see this puts the person in a powerless situation. When you're waiting, you're defining yourself as powerless. You're saying, all I can really do is wait this out. Mm-hmm. Now, humans are terrible at waiting. We're awful at it. If you keep us busy, distracted and engaged, it's not too bad. But sitting in a waiting room, people are not happy, right? They immediately go and try and find something to stimulate themselves. And so I guess what it draws out is that we have to, all phones, yeah, exactly. So just sort of like, this is sort of self-hypnosis. This is self-hypnosis, right? When you're scrolling, but you're not sure why, you're in a trance, you're in a trance state, and you don't really know what you're doing. You're going unconscious, basically. That's why the time can really pass quickly.
Yeah.
Or I'm kind of rambling, but I'll try and draw it back to the question or the other elements. So, we can't see our friends and family who are nearby. So we've got that sense of separation, and it seems very arbitrary. It's like, yeah, you're 5.1 kilometers away, so I'd be breaking the rules, if we go exercise together in a park that's actually, adjacent. And I guess people are being quite scrupulous, around following these rules, and that makes a lot of sense. I mean, I can understand that. Because it seems so arbitrary. Why 5Ks? Why not 5.5Ks? I mean, it's we're kind of allowing the government to really define our freedom of movement, which is, it's quite trusting of us, I guess. So putting it in that context of, okay, well, it's time limited, I guess. What are some other ways of connecting? Obviously, we can do, video chat. I mean, if you think back to our grandparents' generation, they were big on writing letters, right? And what's a letter? It's like a really good text, So it's like a really good text message that you send to somebody, spend a little bit of time doing it, right? But if you look at the quality of letter writing from that generation, it puts what we write in texts and emails, I think, a little bit to shame, actually, because they were learning how to express themselves in a written form where it was actually intimate, and it was meaningful, and it was heartfelt, and it was creating connection. And this was, I'm not going to say it was, it wasn't ideal, but it was sufficient for people to maintain connection, over the last 2 centuries, over long periods of time. And I'm sure, whether you would have had grandparents who sent letters to people in other countries, and it could be weeks or months before they got a reply, but they really appreciated the connection that those letters gave them. So I guess what I'm saying is, if we can pivot to other forms of connection and take those to heart, there's a lot we can probably do, with that. Difficulty with the text, I think, is the style of communication that engenders can be maybe relatively superficial, and it doesn't encourage us to really, I guess, be as fully introspective as we can be. So I mean, if you ever find copies of your grandparents' letters, this is fascinating to look at. What they talk about. They ask each other questions, even though it's going to be months before they get an answer, or weeks before they get an answer, right? How they share just ordinary things about each other's lives. And when you care about somebody, you don't mind hearing about just the ordinary things, because it's like it sort of tunes you in. It's sort of warm. It's intimate. It's it's nice. And it's been a long time since I received a written letter from someone, but it was really nice.
Yeah. No, it's very interesting. I think we've got some really good practical strategies there of focusing what we can do, getting back to getting creative with how we connect, or a new way to keep what we were doing alive with the connect via mail and that type of thing. The last part of that question was just, I think it was talking more about when other people are doing the wrong thing and you see that, how to handle it, perceive it, not compare. I'm not sure, what you've got there, because
it's a hard one, because nothing annoys us more than somebody else doing something which we don't allow ourselves to do, right? Yeah. So it's sort of like, well, if I have to, they should have to, right, as well. And it makes us, I guess, very fixated on wrongdoers, and sort of judging them in our heads. And the way I guess I sort of see it is, I'm not saying I agree with it, but I can understand people being sick of this. I can understand people being like, what, I don't care anymore. I've lost trust in the government. I'm not even sure that we are even being told everything that they know. I think we're being information managed. And if people have decided that they are not caring anymore, I'm not saying I agree with that, but I can get why you might get into that point of view. And I think it's if you can imagine why the person might be thinking that, then you don't have to agree with them, but you're not going to be hating on them quite so much. I mean, can you blame somebody for losing a bit of enthusiasm for the 6th lockdown, and they changed the goalposts? So we've gone for COVID 0. We're not going to manage that, so we're going to vaccinate our way out of it. Yeah. Okay, that's great. Why don't we have the vaccines here? Why is every other OECD country miles ahead of us in vaccination rates? That's not our fault as citizens. We didn't engineer that. So you can sort of see why people's disenchantment with the government has reached a certain level.
Yeah, definitely. I think, yeah, trying to show that perspective or empathy or understanding of everyone's perspectives and responses to the lockdowns. Everyone is different and unique, and unfortunately, they do all respond differently. And sometimes that'll be what you agree and what you won't agree. Now, Phil,
if we can understand it, we don't have to agree with it. But then we're not forced to condemn it. I guess we're not forced to, be so reactive about it. You can realize that the community makes up every single possible point of view exists in this community.
Yes.
And it always will. Like that's not going to change just because someone created a law.
Yeah, big time. Phil, are you happy to go with question 2?
Yep. So I think you've sort of touched on this one a little bit, but it is it'd be valuable to know more about how to motivate oneself in isolation when every day does seem like Groundhog Day.
Yep. Yeah, sure. And that the lockdowns really play with the sense of time. I don't know whether you've sort of noticed it's hard to figure out, like, did 1 week pass, 2 or 3 weeks? Because without those usual changes to punctuate it, our minds are actually quite unsure of how to assemble time. So our sense of time is based on contrast. So if there's no contrast, it's sort of like it didn't really happen. And you notice that when you're in a routine, time is kind of quite rapid. I think the last time you went on holiday, that first week of the holiday, it's like the time just really drew out. It was like long days. Like, this holiday's going to last forever. This is fantastic. And then like the last week of the holiday, or the last few days, are kind of like, gee, it's gone pretty fast now. It's really sort of speeding up, right? And that's because the rate of change and the experience of change is greater in the early part of the holiday. So you go from work routine to, I don't know, Seminyak. That's a lot of contrast, right? So your mind is doing a lot more work processing that environment, and so therefore it's creating a lot more contrast, which punctuates that sense of time. So if every day is the same, it's like it didn't really happen. So where that points us to is we have to inject arbitrary novelty. All right, arbitrary novelty into the day, things that are different for the sake of being different. And it's like, when you're stressed and you're gonna go into routine behaviors and you're gonna do what you've always done. That conserves energy, sure, but it is not stimulating and it is sort of deadening as well. So you have to find ways of doing something different, right? So watching maybe different kinds of programs on YouTube or on your streaming devices. If you go for a walk in a certain direction, going somewhere different. So arbitrary novelty, it's just different for the sake of being different. Yeah, it might seem like it's not that important, but at least it actually will happen. Like, at least it will be an event in your consciousness. Like, if you've got a walk that you always do in one direction, then you do it in the opposite direction, and it's like, it feels quite different. Yeah,
you start to see different houses, different fences, different people.
It's different. It is different from the other point of view.
Yeah. No, that's really interesting. I think I've never thought about it that way, but I think would a good starting point maybe even be like, if you think of all your 5 senses and like you just try and like you said, listen to something different, watch something different, get in a different environment that has different smells of flat, like, using the different senses could maybe be a starting point if you're looking to trick things up or get some contrast, as you were saying.
Yeah, that's right. So seeking contrast for its own sake, let's say, because why do we dislike Groundhog Day? It's because it's just so predictable. It's like it's already happened. And if it's already happened, then it's like it makes no impact. It doesn't really, and it feeds into that sense of just being stuck in waiting, as opposed to, all right, well, how do I live fully within these limitations? I mean, there always are limitations, but this is just really magnified, I guess, how many limitations we have. In one of my before I was a psychologist, I did disability support work, and one of the things I really gained from that was to not look at the limitations that that person has only, but say, well, look, with it, what can they still do? Given their disability, what can they still do? And there's so much they can still do inside quite major limitations. And when you stay focused on that, you get out of the helplessness of the limitation, let's say, and a lot of rehabilitation from serious illnesses or chronic conditions. Helping the person live within limitations is perhaps therapeutically more effective at least psychologically at least, than necessarily trying relentlessly to change some of those limitations. If you can, that's great, but you don't want to base the recovery based on only material gains resulting, if that makes sense. So if you're doing work cover clients, when I'm trying to treat them psychologically, you don't want to base all the recovery on hoping that they get better, because that might actually not happen. And you have to, you don't want your treatment model being utterly dependent on something which you can't control.
Very good. I like that.
On that quickly, would you recommend coming up with a routine for the week? So like on Fridays, we wear pink or something like that, like just creating that definite set of breaking up each day to do one thing.
Yeah, okay. Actually, it's good that you mentioned that, because you can, whilst you can have the idea of sort of routine and planning, you don't want that to become excessive. You can use that as the point at which you diverge from your usual behavior, right? So that's the best of both worlds, I'd say, because if you plan it, it's likely to happen. Whereas if you just leave it to happenstance, then there's a good chance you just.
Yep.
There you go. I like it. There's a few questions. They're sort of overlapping, and I think that this is a good thing because it means that's what people want to hear about the most. So, Phil, did you want to roll into the next question here?
Yeah, number 4. So it's mental state. How do we maintain it during a lockdown? So I think, again, we've touched on it, but how to maintain that positive sort of mindset, maybe.
Yeah. Is there like a checklist, or is there some like, I know it's completely different, but I just think some starting points, maybe a checklist that we can sort of self-check with the mental state.
Yeah, that's really good. I think one of the things we might frequently neglect is looking at, well, what is my mental diet? Okay, not my physical diet, that's in boxes, I can see that. But what's my mental diet? What am I allowing myself to be passively consuming from the media? What am I exposing myself to? Is this edifying, or is this just distracting? You know, is this in any way helping me live a good life? You know, or is it just pure distraction? And I think if we're feeding ourselves mentally on good content, then this has a strong benefit, because if you expose yourself to kind of good media, good podcasts, you know, good movies, good books, your mental landscape is shifted by that and enhanced by that, as opposed to when we just have like sort of fast food consumption of media. It doesn't lead to good thoughts. You know, the mind is quite it's very suggestible. And when you're watching a program, or even a podcast to a certain extent, you're going into a trance state. Okay, when you're watching a TV or a video and you lose awareness of the fact that you're sitting down in a chair and you're just totally absorbed in that thing, you're in a trance. Okay, which means you're not in that moment necessarily able to critically analyze and evaluate what has just been imprinted into your mind, right? By the time you go, oh, I'm not sure I believe in that, it's already kind of in. You might be able to dig it out, but those perceptual sets, they uncritically just draw it in nice and deep, right? So the downside of that vulnerability is garbage in, garbage out. But the upside of that is if you expose yourself to I guess, edifying content, then you're taking in great stuff with no effort, right? It's going right into the back of your head, and it's going to be sitting in there until something relevant comes up. So perception works by priming, which means priming and association. So let's say you listen to a podcast about something, and then later on that day, something relevant to that podcast comes up. All of a sudden, your perception is shifted using that earlier content to view this new current event. So you've primed yourself in a different way to deal with this. And this is how education works, of course. So education is about getting primed to perceive things that you otherwise wouldn't perceive.
Yeah, this is really interesting. I think, I've heard it in different things, like when you're going to buy a car and it's a red Mazda and you start to see them everywhere on the road. It's like that.
Yeah, that's right. You've been primed. Yeah.
You know, your brain's ticking over going, yeah, I've thought about this. And I think that sort of leads into this 5th question that we had here around, there's a feeling of, something hanging over my head or being suspicious of strangers who get too close to me and that type of thing. And that might be that diet in of the, you know, the virus is everywhere and it's airborne. So therefore it's all consuming. Where if we consumed a different diet, maybe we might end up with a different perspective towards this.
Yeah, look, this is a really hard one because we've been the conditioning here has been absolutely pervasive around this idea that the human beings that we want to connect with are now being coded as potential pathogenic, you know, like disease vectors, basically. So how does someone become, you know, my fellow human being, my neighbor, you know, my compatriot? But now it's also like, are you going to cough on me and kill me and my family? You know, so dealing with that kind of like cognitive dissonance, you know, we want to connect. We also don't want to become, you know, die and become sick. So I think the pandemics historically have a real fraying effect on communities and societies because they highlight all the differences between different groups. And you notice a lot of kind of subtle and not so subtle racism in people's description of other groups. Look what they're doing as opposed to what we're doing. And all these differences start to become highlighted. And it's very difficult to know how to kind of totally counteract this because during a pandemic, people are quite fear sensitive. And so they're very sensitive to differences. And one of the major differences we have is between different groups, right? So we become heightened in our attention towards difference, and the reasons for picking up on it become more salient to us as well. I'm really just fleshing out the problem here, but in identifying it, maybe we can, I guess, retain some self-awareness. I don't know how we overcome this kind of conditioning because it's absolutely you know, pervasive, and some people won't recover from this. Unfortunately, they won't want to leave their homes even when this is sort of kind of over. You know, as far as for the mainstream, so these things have a very long tail on them.
Yeah, and that's where it might, like, I was thinking it's probably going to take some time to heal as well, like, you know, in terms of becoming more aware and accepting of, you know, people walking close by without a mask on. I think that might take time, or shaking hands again. Some of these so-called old things, you know, 8 months ago might take a little bit longer just to bridge that gap and come back to it. Now, there's one really question I want to get out here, and it is, how can you tell someone that I think seeking professional help would be a great idea because there's been a notice in behavior or changed behavior, when they don't think there is anything wrong with them? I think this could be the hardest question. I don't know.
This is tricky, because when we go into a bad, that's a clinical word, bad psychological state, we tend to lose insight and self-awareness. So the person's a bit more unwell than they themselves even realize. They might be minimizing it a bit. Yeah, look, I'm a bit irritable. Yeah, I'm not feeling so great at the moment, but, you know, they just sort of shrug it off because part of their way of coping with it is to remain unconscious of it. They don't really want to confront the fact of how precarious their state actually is. And so, I mean, you could ask the person, say, look, you know, you're telling me this, or I'm observing this. How much different is that from how things were beforehand? And if they can notice the contrast, then that can help. If they do notice the contrast, you can say, well, look, is this something you want to do something about, or do you just want to sort of see if it gets better by itself? A lot of people will choose the second one. I just want to see if it gets better by itself, and that's an okay choice to make. But you could add to that and say, yep, that seems reasonable. But if things were the same as they are now in, you know, a couple of weeks or a month or what have you, would that be a bit of a signal for you of maybe looking at some help? And like a reasonable person might well consider that would be, that's reasonable. It's like, if I was feeling the same way in a month's time, let's reevaluate this kind of you know, ostrich approach to the problem. Because I mean, many things do kind of go away by themselves. So this isn't totally wrong way of thinking, but it's like, well, can this person benefit from professional help? Now, part of it is they don't want to see themselves as somebody needing help. Perhaps they're helping many other people, or they see themselves as, oh, I'm a sort of strong, resilient kind of person. I don't have mental health, you know, problems. It's funny because if you ask somebody, do you ever get physically sick? Everyone says, well, of course I get physically sick. That's just being a human being, right? But if you say, have you ever been mentally unwell? Oh, I've never been mentally unwell. And it's like, are you sure about that? Are you sure you never felt so down or so contracted that you weren't able to do things that you normally would want to do? And it's like, oh yeah, I've had that. It's like, well, that's just low level of being mentally unwell. That your mental psychological state impairs your ability to function as you usually would. People are stuck in a very binary category of this: mentally well, mentally unwell, right, which they're not so fixated on for physical health, because many people have chronic conditions that they just live with. But we could say with mental health, so it's not so much of a binary; it's more of a spectrum. You've got times when you're really flourishing, you're energetic and inspired and creative, and you're great fun at parties, and there's times when you're kind of contracted and bored and not motivated, and your sleep's bad and your habits have all slipped, and you're somewhere in between, right? So try to, I guess, to convey it on a sort of a spectrum, because mental health is on a spectrum, but whether you seek help is a binary. You either do or you don't. So it's the pivot from broad spectrum thinking then to a binary thinking of, well, do you or don't you? That's the conversion point that perhaps is more of a struggle for people.
Yeah, fantastic. I can see there's 3 minutes left on the Zoom call. I'm going to try and sneak one more question in here. It's been fantastic so far, Alex, and I'm going to summarize this as well. So you'll get that after this. But I just wanted to ask a quick question. Is there more mental health problems with children and youth these days in perhaps comparison to 50 years ago? And then maybe how's the pandemic impacting on this, or what are you seeing at your end?
Okay, this is a very each of these questions could easily take an hour, so I'm going to try and
we might even do that. So I appreciate your summarized version here.
All right, so are children worse off? We're much more sensitive to problems that in the past we just ignored and minimized. That is one thing that is definitely obvious to me. So people have diagnoses now that in the past we just said, oh, she's a bit moody, yeah, he's a bit quiet, and now we say that's not really a good enough categorization. I think the fear programming is pretty intense. But having said that, if you look at the last 100 years, there's fair few things that happened that children bore the brunt of as well. I think the expectations maybe are expectations are different, perhaps. So I think children in earlier periods of time expected that life was going to be hard and difficult, and you probably had to take the bull by the horns, or you're going to get thrown to the side. Maybe that is less encouraged in people's mindset now, in hoping that life can be good and you can be happy. Maybe, but maybe that's not what you should aim at. Maybe happy is the byproduct you get from other things that work. I speak to a lot of young people who struggle with direction. They don't know what they should do. And when you unpack that question, that is not an easy question to answer. What should one do as oneself in this world?
Yeah.
Where do you begin, right? And this relates to the second question here, which you've got around about religion. And I think that these things are linked, because one of the advantages of religion massively is that it creates an enormous context, an immovable context of what value is and how one calibrates value relative to other things. It at least gives you a ruler. If nothing else, religion gives you a ruler. If you haven't got a ruler, how will you measure anything? How will you measure the good from the best or the bad from the worst? People really struggle with these questions of value, but without value, how do you find the thing to strive for and the thing to motivate yourself and focus on? It's not immediately clear. Without these things, people succumb into sensation seeking and egocentricity, and they're not much fun to be around, so they withdraw into their bedroom.
Yeah. I'm going to just be mindful of time. We thank you so much, Alex, and we will unpack these questions probably even further, but it's been an absolute pleasure to have you on here. Phil?
Yeah, it's been an absolute pleasure. Thank you so much. A lot of really cool insights.
All right, good. Hopefully it was helpful, not too rambly, but yeah.
Oh, that's great. I'm going to cut this up. I'll write a summary. Everyone's going to love it. Thank you so much, Alex, and we'll be talking soon. Cheers.
All right.